In breast augmentation and breast lift patients, we assess the breast skin elasticity, the volume of the current breast, and the ptosis level if there is any. In breast augmentation patients, we insert an implant and augment the general volume of the breast without any lift procedures. So the scars that we leave behind are usually at the inframammary fold, extending between 4 to 6 centimeters long. When a patient has a grade 1, 2, 3 or 4 degrees of ptosis, then we need to lift the nipple areola complex upwards so that the breast in general will have a better shape in combination with an augmentation procedure. The degree of ptosis depends on the skin elasticity, on the suspensory ligaments of the breast, on the number of pregnancies and lactation after the pregnancies. When we have a patient with an augmentation and lift procedure that we are planning to do, we assess in general all of these things. And then we decide about the size of the implant. And the size of the implant usually depends on the volume of the patient's current breast, on the breast width, and the general cup size that we want to achieve. In a breast augmentation and lift patient, we may leave a periareolar scar only. We may leave a lollipop scar where the scar is around the areola and from the 6 o'clock position of the areola to the inframammary fold. Or the patient may have an inframammary fold incision and a periareolar scar in combination. Or the patient may have a T-scar and also a periareolar scar. This depends on the ptosis level and in general skin elasticity of the patient. What we want to achieve after this surgery is a better shaped breast and acceptable scars after the surgery. The scars are usually fading in a few months' time after the surgery. We recommend some scar creams to the patients and silicone gels to use after surgery. The surgery of breast augmentation and lift usually takes between 2 to 4 hours. If the surgery is in the morning, the patient may be discharged in the evening. If the surgery is during the midday or in the afternoon, then it is best for the patient to be discharged the next day. She may have drains after surgery and the drains may be removed the next day or 2 to 4 days at most after surgery. We provide a medical bra for the patient that does not have an underwire and also it's elastic around the breast, but also makes some acceptable amount of compression on the breast so that the edema resolves quickly after the surgery. The patients are seen 24 to 48 hours after drain removal and usually 3 to 4 days after the drain removal twice until the patients go back to their home country. And then we follow the patients through videos and photographs until the first year of surgery in the first 3 months, 6 months and 1 year after their surgery. All breast augmentation and lift patients need to have information about whether they can be able to lactate or not if they are planning another surgery. And also they need information about the implants, the brand of the implant, capsular contracture, and ALCL, which is anaplastic cell lymphoma. We give consent forms containing all of these informations, so please make sure to ask about these as well.